get some insight from our panelists today with those answers. So we're going to just jump right in. And our first question is, when you were diagnosed, how did you learn about the condition and decide on the best approach for your care? And I'm going to start today with Jason. Can you just talk a little bit about your diagnosis and different ways that you learned more about your condition?
Yeah, I sure can. So I learned that something wasn't quite right with my numbers, my blood numbers through my annual physical and blood work with my primary care physician at the end of August last year. And I didn't see my oncologist and do kind of the more extensive blood work that's necessary until mid-October. So it was kind of a time span there. And then even though my blood work was pointing to CLL, when I did see my oncologist, she reserved diagnosis until I had a PET scan, and she was able to see those results. And that wasn't scheduled for another month later until just before Thanksgiving. So it was kind of a little bit of a process to find those out. Thinking about some resources during that time, well, I kind of had an idea that I was going to be diagnosed with CLL, but in wanting to learn more, the resource that really helped me understand my blood cancer the most was HealthTree University. So there was a lot of really great articles through other foundations like the Leukemia Lymphoma Society or the CLL Society. They're great foundations, but HealthTree University is a video-based learning. And not that I dislike reading, but this was really kind of an important form of learning for me. And I found it was really important to see the doctor's body language, their facial expressions, hear the tone in their voice when they're explaining a really emotionally charged thing like blood cancer. And with other resources, I kind of felt like I was bouncing around aimlessly, where with HealthTree University, it's a curated style learning. So in other words, HealthTree has done the work of walking me through the learning process and taking me video by video, kind of in a logical order of learning. So that was a really important resource, really the most important resource for me. And then, as I look back, I kind of ask, what would I done anything different to advocate for myself in those early days? I think the primary one that comes to mind is I would have asked my oncologist at that first appointment to explain watch and wait, explain what watch and wait is, and why we're doing that. Because pretty much every other cancer or type of cancer, when you get diagnosed, you go and attack it with chemo or radiation or surgery or some combination of those. You go get it. You get that diagnosis, and then it's like, okay, what are we doing about this? And with chronic blood cancers like CLL, HCL, and others, watch and wait, or we're not doing anything right now, can be kind of, well, really very confusing and kind of off-putting. So I would have asked my oncologist more about watch and wait, so I understood that more.
Absolutely. Robin, can you tell a little bit about your experience? So, you're kind of in a similar situation as Jason, just as far as watch and wait with the smoldering diagnosis. Can you talk through that experience for you as well?
Yes, sure. So when I was initially diagnosed with MGUS, it kind of came out of the blue. I had, as you mentioned in my introduction, I've had three prior cancer diagnoses, and as Jason pointed out, with those, it was a whirlwind, and I was, in treatment practically before I could blink an eye. But with this, I just went in for kind of a normal, regular screening with my primary care. Some labs came back abnormal. One lab led to another lab until it led to this diagnosis. And I had never heard of it. I didn't know what it was. But I was referred to a hematology oncologist, and he had said, it's a precursor to multiple myeloma, which I'd heard the words but didn't really know what that meant. Um, and honestly, I didn't even look it up because he said you have the MGUS, which is a precursor, and it might never become multiple myeloma. So we're just going to do a watch and wait. And, scheduled me to come back every 3 months for blood tests, and I would see him every 3 months. And it was basically the same for, I guess, about, 3 years. As far as the watch and wait, I had had a medical condition many years earlier when I was in my 30s. 40s, and it was a condition where I also had to watch and wait for many years. So I was used to that terminology. That didn't throw me off. And quite frankly, I was happy to watch and wait because if it was a condition that I might never get, I wasn't in any rush to deal with it, quite honestly. Um, by 2023, then my um, some of my labs started to elevate, and he said, I think maybe it is starting to advance, and sent me for some additional testing. I had a PET scan and bone marrow biopsy, and he said, well, it's now progressed to smoldering myeloma. I honestly didn't know what that was, and maybe I was in denial. I mean, I guess as a health professional, I don't like to think of myself as being in denial, but I probably was because I didn't even bother to look that up. It's like, okay. But his tone changed. He says, I think we need to probably start considering treatment. And it was like, well, my feeling was he was still saying this might never become multiple myeloma. And my feeling was, having gone through treatments before, if this again still might not progress, I don't want to consider treatment. And I can get into it a little bit more later, but he started pushing that, and I started to feel very uncomfortable about that. But I was happy during the watch and wait period to watch and wait because that meant, I didn't have to really deal with it and deal with treatment and all of the potential side effects and things that went along with it.
Absolutely. The thing I wanted to highlight with both of those stories is just the fact that there's no right answer, unfortunately. Like it's very personalized when you're in a watch and wait, whether you want to be completely, informed or if you just want to sit, just wait, just watch and wait. So I just want to encourage people, if you want to learn more or you want to dig in, as Jason mentioned, we do have HealthTree University, but it's also right to just wait. Robin, go ahead.
Well, I would just add that in hindsight, and I should have really done some research. I really should have spent some time. I would not encourage anyone to put the blinders on and not do some research about your potential condition. Um, and I will add, I mean, I guess it's not like I didn't look at it at all. I've mentioned to you before, my son is in the biotech and farm industry. So I did talk to him and he was doing some research for me and he was giving me some information. But I didn't do what I would suggest now to people, and that is look for credible resources such as HealthTree Foundation and the other foundations so that you can anticipate what might be coming along. So I would not at all recommend anybody address it or approach it the way I did. That was not probably the best way to do it.
I was going to ask Robin, so do you feel like you were maybe protecting your mental health a little bit in that situation, or why did you
Uh,
choose not to?
Yeah, I think so. So the most recent cancer diagnosis that I'd had, it was in 2018, and not to get into it, but I had a melanoma diagnosed on my face, and so I had to have extensive surgery to remove that, and then I had like five reconstructive plastic surgeries over the course of several months, which I found very traumatizing, and I think I was just recovering from that when this MGUS diagnosis came about. And honestly, it was like I was very alarmed by it. And why was I getting a fourth cancer diagnosis in the span of, not that many years? And so I think it was just overwhelming me at that point to really deal with it. I did reach out to my oncologist and asked to have some additional genetic testing done to find out if there was anything, in my genetic history that would indicate why I was getting repeated cancer diagnoses. So I think it was kind of around that. So I mean, I was certainly kind of doing some things about it, but I wasn't really wanting to tackle what multiple myeloma was because I was just recovering from this previous cancer diagnosis. I think that was probably a lot of it.
Yeah, absolutely. Thank you so much. I know, Cassandra, I'd like to jump into your story a little bit because your experience was a little bit more acute. You went from finding your diagnosis and If you just want to tell us a little bit about that and when you were diagnosed, how did you learn about your condition and decide your best approach for your care?
Well, as you said, I was diagnosed in 2018. And what led me to my diagnosis was I was having extreme back pain. And because I was relatively young, I equated the back pain to, maybe I need more exercise or, I may have strained my back or something. But it got to the point where it was so excruciating that I could not turn over in bed. So it prompted me to go to, the hospital, and they ran some tests, and it came back with something called a nucleated red blood cell. And I said, I don't think that's supposed to be in there or whatnot. So, I decided to try to get to a hematologist to see what was going on. The hematologist told me that I had nothing to worry about, but being someone who was only 48 at the time, who had either a cancer diagnosis or cancer scare since the time I was 13, I said, you know what? I think we need to kind of investigate this a little more. And I was told that, I would be fine, but it was just something that was not sitting with me. So I made an appointment. They did another test. They said, okay, we do see something. And I referred over to hematology oncology. And that was quite of an experience as well, because even though these things were showing up in my blood labs, they were still hesitant about doing a bone marrow biopsy. So I kind of contemplated that, but again, I've had cancer before, so my reckoning was, you know what, if I have something, I want to deal with it now. So it wasn't, the point of me waiting to see. I really wanted to find out. So they did do a bone marrow biopsy, and that's when I was diagnosed with multiple myeloma. So things kind of went rather quickly with me. And on top of, having multiple myeloma, I was found to have IgA kappa and lambda myeloma. So I'm biclonal with heavy and light chain, which, is something that added another layer to what I was dealing with. So, when I found out, it wasn't necessarily that I was nervous about it initially, because again, I'm used to hearing the word cancer, but this particular cancer was something that you could not just have surgery to remove. And that's what made me very concerned, because it's plasma, it's blood. So how do you fix that? So I did start reading up on it, and I found HealthTree. And this is when HealthTree really started, they were new. And this is when Jenny was the founder of HealthTree, tour bus, and she would go around to different states and so forth. And I went to one of her events. And from that point on, I've always been involved with HealthTree. I'm a patient advocate. I do speaking engagements, and I really, this organization has really shown me a lot, has educated me, the support system, and so forth. And it has enabled me to ask very informed questions, because I've learned about the disease. So my approach is to, educate myself, ask questions, and just advocate for, my health overall.
Absolutely. Thank you so much. We'll move on to the next question. So, after your diagnosis, who or what was most helpful to you, and how did you find that support? If it's okay, Robin, I'd like to start with you, and we'll go around and jump in as you'd like.
Okay. Well, as I mentioned, my son is in the biotech industry, has been for many years, and in pharma also. So as soon as I got, as soon as well, so I got as soon as I got a call from the nurse who said that I might have multiple myeloma. She didn't even say my MGUS. That's at the point where I freaked out. And I was referred to the hematology oncologist. My son Jason came with me to the appointment. So from the very beginning, he was with me, and he knew the questions to ask much better than I did. And so I would say that, even from the beginning with the MGUS diagnosis, he was probably the one that was most helpful. And maybe that's why I didn't feel the need to really do a lot of research on my own, because I just needed to text him or call him. Um, I think that's probably the best answer is, he was available to me because it was a watch and wait for a few years. There wasn't really the issue about treatment, medications, and that sort of thing. But when it got to that point, in early 2024, and I guess spring of 24, when I was diagnosed with active myeloma, he was, of course, along with me and coming to the appointments with me. So, so I would say, I felt very lucky because I had him as my resource, and he was able to connect me with some of his colleagues. Um, we'll probably talk about it, or I can mention it maybe later. When I was looking for a referral for a different doctor, he connected me with a hematologist colleague of his who got me in touch with somebody else who got me in touch with the doctor who I'm now seeing. So I feel lucky that I had kind of an inside track with him. So that was, I think, probably he was my most helpful support.
It's awesome. It's good when you're able to lean on those people who are closest to you, who know you the best. So that's wonderful. Jason, with your diagnosis, who was the most helpful to you?
I would say it was my wife. She was probably the most important who for me. I don't know why, but I tend to be a little bit lazy when it comes to my healthcare, and I'd be more like, the doctor will tell me what I need to know. And my wife takes a bit more of a self-advocating approach. And so she helped me kind of think through the questions we wanted to get answered. I remember lots of nights too, kind of pre-diagnosis, but we had a suspicion. We're researching CLL, and I found HealthTree University, and so we have dinner, put the boys to bed, and I'd be watching HealthTree videos on one end of the couch, and on the other end of the couch, she's, researching, what are the things that we can do or maybe should do, positive changes to make in our diet, in our environment, that kind of thing. So it was a good a good tag team approach, and so she was my most important. What My parents, my wife's parents, a close circle of friends were also important early on, before my diagnosis, and after my diagnosis, and publicly sharing that. My church community has been a big source of support and encouragement for me. And then as far as the what, again, that for me, that was HealthTree University. That was really important part of my journey.
Thank you so much. And Cassandra, can you just talk a little bit about your support?
So I would have to say, definitely my sons, they're older, they are big support systems. My fiance and my mom, she was a huge support system. And I also connected with an oncology social worker because they have a lot of information they can share as well. And I remember going into her office and kind of picking up any pamphlet that I saw that related to it, because even if it didn't apply, it might apply to somebody. So the oncology social worker, and again, just relying on friends and family.
Thank you so much. I think you brought up a good point there that I think we're going to touch on a little bit later as well, but just knowing the resources that you have at your hospital, reaching out and asking for the additional support or information from the people in your care team. So I think that's a wonderful resource. Thank you. So this is kind of the meat of what we want to talk about today. So I think, you can have all this information, you can learn so much, but being able to speak up for yourself is so important. And that's one of the main themes I wanted to bring about today, was just how you were able to speak up for yourselves in the different situations. Cassandra, you've mentioned previously just some of your advocacy work, and I'm wondering if you could just tell a little bit about that.
Sure. So as an advocate, a lot of times I find myself in situations where I'm just not advocating for myself, I'm advocating for other people. And there was one such time, a hospital organization who wanted to completely turn individuals away who could not afford their copays and or delay their care. And being a cancer patient and knowing other individuals with terminal and chronic illnesses, I said that is not a good policy. So this led me to actually filing a restraining order against this organization to halt that bad decision. And it actually went to federal court. And it was dismissed because we came to an amicable agreement. But the significance of it to me is that I was able to have patients have a continuum of care, that their care did not stop because of affordability or lack of access or anything like that. So cancer patients were able to continue to get treatment, and other individuals like that. So I think that was one of my biggest, advocacies. And I am grateful that I was able to, again, not just myself, but other patients. And currently, there is actually piece of legislation that I wrote that's at the state level, that all organizations in the state of Ohio can enter that, where they will be able to do that again, but find other ways to fund sources to treat patients besides turning patients away from that detriment that they did.
Thank you so much. I think having somebody in your corner and knowing people that are in the front lines and just trying to move things forward and keep everything good for everybody, and just being those advocates when we're not necessarily able to advocate in those situations is so important. Robin, I'm going to ask you just to talk about your story, asking for the dietetic referral. I think that
Okay.
that's an important topic as well.
Sure. Well, as you mentioned in my introduction, I'm a registered dietitian. I'm retired, but I still am a credentialed dietitian. But I didn't in my career really work for very long in a clinical position, but I did work with a lot of interns who were being trained clinically. So I'm very much familiar with kind of the process of, or how the process should be within a healthcare institution to refer to various ancillary health services. So, but again, as a dietitian, I kind of thought, well, I kind of know the recommendations for nausea or for various, side effects to treatment. Um, so when I did start treatment, I thought, well, I'm well equipped to deal with, any situation if I start to have issues, which I did very quickly start to have issues with a lot of nausea, a lot of taste. Um, I don't know I can't think what the technical term, but everything tasted funny. The smell of food was made it even worse. So if I wasn't already nauseated, the smell of food just, set me over the edge. So I was having a really difficult time eating. I had used up all of the tools in my toolbox as to what I thought should help. And I, was losing a lot of weight, and I hadn't actually seen my specialist probably, well, I saw her every month, so probably hadn't seen her for a couple of weeks, but I had to go into the cancer care clinic, and I was talking to one of the nurses, and talking to her, it was probably the nurse practitioner, about all of the issues with not being able to eat anything. And I said, can I get a referral to dietary? I had seen in the infusion waiting room, there was always like a sign up, if you want to have an appointment with the dietitian, call this number, and they're there, Wednesdays. Well, I was only ever there on Mondays and couldn't go back on those days. So it wasn't really very conducive, to really being able to set up an appointment. So anyway, she put in a referral for me, a consult to dietary for me. And I never did ask my doctor why she didn't make a referral or offer to make a referral when she saw, once I started to lose weight, and she knew how much trouble I was having eating. So I don't know if the doctors kind of leave it up to the nurses to make the referrals. I'm not really sure, but I really felt like I said, I'd used up all of my ideas. And quite frankly, some of the ideas I thought would work, I couldn't even do because I was so nauseated that it didn't even matter. I knew to try to eat this or to try to eat that. Well, I wasn't able to. So I just felt it was important, to speak with someone else who maybe was a little bit more knowledgeable about oncology nutrition, because that wasn't my area of practice. And it was really very helpful when I did have my video appointments with her. with a dietitian. I did tell her at the outset, I am a dietitian, but I'm not an oncology dietitian. But it helped kind of open up the conversation with her. Um, I'd like to add to that too, is that I was at a HealthTree summit. In fact, this is when I really got more involved with HealthTree I think it was last March. And then I was more recently at an International Myeloma Foundation conference just a few weeks ago. And in both of those conferences, audience members, other patients, asked questions about nutrition and what to do, when you're nauseated, or what's the best diet to eat if you have myeloma. And none of the panel members, the physicians on the panels, ever said anything about a diet, a referral to a dietitian. They were talking about, oh, kind of the routine things that people will say. Well, eat smaller meals or whatever. And in both instances, I raised my hand so the mic could be brought over to me, and I said, if you're having problems, ask your provider for a referral consult to the oncology dietitian. And then, in response, the doctors who would be speaking on the panel said, oh, yeah, that's a great idea. Make sure to do that. But they didn't think to, even in that situation, make that recommendation. So ask for referral to any of whether it's social work, because I had to ask for a referral to social work also. That wasn't offered. But don't be afraid to speak up. Ask, and if you're not sure, ask, is there someone else on the team that can help me with this? Because I think most patients wouldn't necessarily know to ask for a referral to a dietitian. So whatever it is, ask if there's someone on the team who would be able to help. Even if you think you know the answer, you probably need some additional support also.
I love it. I think two things that came up for me there. Number one, I said this when we were speaking earlier, but I'm a nurse, and you would think that advocating for myself would be easy. I speak to doctors, I speak to nurses all the time, but it's one of those skills that I think if you don't practice it, it can be tricky. So I want to come back just for a second because we talked through just some of the different tools that you can use to advocate for yourself. Specifically, Robin, I know you mentioned, bringing somebody with you. Was that helpful in, making requests or talking through advocacy?
Oh, well, that's an interesting question. So my husband has come to all of my appointments with my myeloma specialist, but he never says anything and he never asks questions. So once I started treatment, I started making a list of questions before I would go in, and I would type them up and I would bring them in, and I would just, once, I had the discussion with the doctor, the things she wanted to talk about, I would start to go through my questions. So I think it probably depends on who the person is that is coming with you. When my son Jason comes with me, he has his own questions. And so, discusses those with the doctor. So I think it depends on who your person is. If, my person isn't one who probably would advocate for himself very well, I go with him to his appointments and I'm always asking the questions. So, um, if you're uncomfortable, I mean, again, as a health professional, I think I've learned, and having had different medical conditions, I've learned to advocate for myself and the easiest way for me to do that is to list the questions ahead of time, because once I get in there, I know I'm not going to necessarily remember them, or I get a little bit nervous about asking questions. So I think it's important so that's what I do, and that's what I would suggest. Even or have if you have a person who is more vocal, have them keep your questions and ask the questions for you, and jot down the answers, because that's hard to do while you're listening also.
Absolutely. And I think sometimes maybe the answers come at you and maybe you've got one word or one thing that really sticks, but then they just keep going and there's so much more that's important to understand. I'm wondering if I could ask Jason to just talk through the request for the referral as well that you had.
Yeah, you bet. Before I do that, I wanted to mention, I think in our conversation before the webinar, Robin mentioned something, I think, about recording your doctor appointment, which I thought was great, because if I look back or remember, how many times Heather and I debated what we actually heard, and what the answer we thought we heard was, having a recording kind of felt pretty important. So that was really great, Robin.
Thank you.
I'm sorry, go ahead.
Oh, no, go ahead.
Yeah, so before my journey began at the end of summer last year, I lost my PCP to a flat monthly fee, no insurance, come and see me as often as you want model. And just before my meet and greet appointment for my new PCP, I learned that she was leaving for the same model. We ended up keeping the meet and greet appointment anyway, and she probably broke a rule and did my annual physical and ordered blood work anyway at that appointment. But after the first blood work showed concerning numbers, she ordered a follow-up round just to make sure that what we were seeing wasn't an anomaly. And before she could look at that blood work, her time at the clinic was up and gone, and she was gone. So this was like literally within days of each other. So, here we are, we've got some concerning blood work, and now I don't have a PCP. And the clinic had told us at the time that they didn't have any providers to shift me to. And so, as far as advocating, my wife's PCP was also at the clinic. So she sent her physician a message, and Jason has these concerning numbers in his blood work, and his provider's gone now. Would you please consider looking at his blood work and taking him on as a patient? It was kind of a long shot, but why not ask? And so she did. Later that day, her physician sent a message back that she had looked at my blood work and that she was immediately referring me to hematology oncology, and that she would take me on as a patient. So that advocating for me, that was huge for us. That what my wife did. And something that we had to self-advocate for. And then since last fall, she's left the clinic for the same model. So that's three physicians that I've lost since last spring to the same model, and kind of been struggling to establish a provider that we hope is going to stick around. So that's kind of a continuing saga, ongoing saga for us, as far as a way that we need to advocate for ourselves. Is I want to, I'm pretty healthy generally, other than this cancer diagnosis, and so I don't, outside of that, haven't really been too concerned about needing a physician and seeing a physician annually. But it was at that annual appointment that I learned about that I had CLL, and so I do want to stay connected to a physician. Unfortunately, it's becoming increasingly harder to find a physician and keep a physician, at least in my area. I don't know about the rest of the country, but so we have to continue to do that. And if I lose a physician, I will just continue to work through that and try and establish care. So.
Thank you so much. I want to jump back to Cassandra because I feel like you've got such an amazing background of advocacy. Did you find with your myeloma experience, was advocating for yourself hard, or because you've got your background, did you find you had some strategies that made that easier?
Advocacy for me is hard because it's just what I do. And so when it comes to myeloma or any illness, I have to understand it. And that's the way that I beat it. So I have to advocate. So because I want to live, I want to be around. So that's how I look at advocacy. And back on what Jason said, as far as the availability of my specialists, I know that it was either 2019 or so that I learned that there were like 12 myeloma specialists that were specialists in Ohio. So you look at specialists, you think about what actually does that mean? So you have a lot of physicians who could work with myeloma, but some maybe 90% of the time work with myeloma patients, and some specialists only spend 10% of their time working with myeloma, patients. So that's the difference in when we, term specialists, and that is something that definitely concerns me as we're learning more individuals are being diagnosed with myeloma or CLL, and so getting our young physicians and people entering, medical school to start looking at these other cancers as well, so that we can have more people who are trained, in the field. And also feel that for me, I was told that I knew too much by an oncologist. And I can say that it definitely made me feel a certain way because everybody has their own level of understanding, right? Everybody has their own level of research. And I felt that he thought I was challenging his knowledge. I'm not challenging knowledge. I'm trying to understand what's going on with. So I'm going to come notes and with the recordings and with everything else in my hand so I can better understand how I can help my. So, be your own best advocate. That's the only way you can beat your opponent is if you learn what it is you're fighting. So that's just, advocacy.
I love it. So, getting a lot of information and a lot of knowledge under your belt helps with feeling a little bit more confident about talking with your provider and making sure that they've got all the information that you have about your own body, which is something I know we talked about as well as, you don't, you know yourself better than anybody else.
Yeah, because I want to add, like, we're a team, and I'm not a physician, I'm not an oncologist, and I understand. But at the same time, like you said, I do understand my body, so we're not bumping heads with each other. We're actually trying to figure it out together.
Absolutely. Thank you so much. I'm going to move on to the last question here, which is kind of wrapping everything up all together for us. It's what one piece of advice would you give a newly diagnosed patient to feel more in control? And you can go in any direction with that, whether it's, how you learn to advocate for yourself, if it's education. So I'm going to just start with Jason on this one. If you just talk through what's one piece of advice? And I do want to actually, before I start with Jason, just recognize two things here. So number one, we do have a lot of different blood cancers on today, and I wanted to bring Jason on because of his experience with CLL. So with that, every blood cancer is just a little bit different. And so I just wanted to, put that out there, make sure that everybody's kind of on that same page. The other thing is we do have quite a few comments happening in the Q&A. I just wanted to let you all know that other people aren't able to see the Q&A outside of the panelists. This is a little bit different than some of our other meetings. Some of our other meetings, we have the chat where people are able to interact. So if you're not seeing an answer or response to your question, and it is more just reaching out to community, do know that I'm seeing it and our panelists are seeing it, and we'll do our best to make connections where we can so that you can get that sense of community. But just know that that's the reason you're not seeing an answer. So with that, Jason, could you just tell us what one piece of advice you'd give to a newly diagnosed patient?
Yeah, I don't know if I can get it down to one, Cindy. So maybe three quick ones if you'll let me. First, man, don't be afraid to ask your oncologist questions. I think we've kind of said that here. What does that mean? Why are we doing that test? Why are we not doing that test? Would you order that test for me anyway so that I can have peace of mind? And that kind of goes back to Cassandra's statements about advocating, but also, not being afraid in that appointment to ask those questions and don't let a physician or anybody tell you or make you feel like you're too much. Do your research if you want to and you can, and come to the table with informed questions. You don't have to play dumb. I think you can come to the table with informed questions, and no question is dumb, and you shouldn't be made to feel that it is dumb. If you get that sense at an appointment, we'll go see a different oncologist. You want to have somebody fighting for you, not against you. Second, ask your oncologist if they're a specialist in your blood cancer. And if they aren't, ask for a referral to a specialist that maybe they know and they like to work with. And that's what I did. And if they don't know anyone, find your own advocate. You can find or find a specialist. You can find a specialist through different resources. HealthTree does that as well in helping you find a specialist. and get an appointment with them, at least a virtual one if in person isn't practical for you. I'm very happy with my local oncologist and I trust her, when the time for treatment comes, but she's not a CLL specialist. So I have a specialist on my team that I asked her for a referral to, that'll be driving, treatment conversation with me when the time comes. And then my local oncologist will carry out those treatment decisions and care for me. And finally, find a coach for your particular blood cancer or a group of patients that you can help you understand your blood cancer in between appointments with your oncologist. They can share their experience with you. We don't have them yet, but I know HealthTree is working on coaching for CLL, so I'll be looking forward to that. In the meantime, Facebook groups can also be a good resource for newly diagnosed patients to meet veteran patients and help them understand their blood cancer.
Perfect. Thank you so much. I'm going to come back to a couple of things that you said there. Number one, just that willingness to advocate for yourself in asking for a second opinion. That's so important. It may be an awkward conversation. It may be something that feels weird to you. You don't want to feel like you're disparaging the doctor in any way. But at the same time, standing up for yourself and, getting that information and having another set of eyes on your labs, on your case is super important. So I
Yeah,
really
and that was
appreciate.
me. I was very much so like, oh my God, ask for a referral. It feels like I'm, not confident in my oncologist, skills or their abilities. And again, it was my wife who was like, no, it should be okay. And as a matter of fact, if you have an oncologist and they're not okay or they're agitated or offended by you asking for a referral or to have a specialist on your team, they may not be the oncologist that you should be seeing. Your primary oncologist. Maybe you would, want to find a different primary oncologist. So,
Absolutely. I've seen a bunch of heads shake. I don't know if everybody can see all of the panelists here, but both Robin and Cassandra are both shaking their heads, listening to Jason. I did see Robin, you had something to add there as well?
No, I was agreeing with everything that
Okay,
Jason
perfect. I
was
just wanted to
saying.
make sure we weren't missing anything. Thank you. Um, Actually, since you've just unmuted, what is one piece of advice you'd give, Robin?
Well, I would agree with every single thing that Jason said, and those would have been the three things that I would have listed. Um, and absolutely, if you're not satisfied with your provider, ask for a referral or just go seek out a referral. I believed, everything that he said that, if you ask for a referral and the doctor's uncomfortable with that, then that's not the right doctor for you. But I was so frustrated with the doctor, the myeloma specialist that I was seeing because with the the smoldering diagnosis, he kept this was over two or three different appointments pushing me to start treatment, and I would say, why? Why, why do you think I should do it now? And I was never really getting any response. So, I was very frustrated, and that's when I asked Jason, do you know anybody maybe that could help out here? And then I was able to get referrals that way. And quite honestly, I never did go back to I canceled my next appointment with the first doctor and never went back. I just thought, I'm breaking up with him. I'm not going back. But that was kind of the coward's way to do it. I probably should have just asked for a referral, but the outcome was still fine. Um, but anyway, not to get into that, I think the thing that I maybe would add in terms of looking for resources is make sure that the resources that you're looking for, if you're looking for online resources, are credible. Um, and I did join some Facebook myeloma support groups, and that's what will frequently be posted there. Don't get information from Dr. Google. Don't look for Dr. Google. So if you're not sure who the credible resources are, then maybe ask someone on your medical team where to get information. I used to tell students and the coachees that I have, of course, I always recommend HealthTree. I recommend, the organizations that have already been brought up. But to look for resources that end in .edu or .org. Don't look at resources typically that have a .com after them because they may not, doesn't mean they're not credible, but they may not be. So make sure you're looking for credible resources. Um, because you want to make sure that the information that you have is up to date. So maybe that's one thing that I would add to what Jason already mentioned.
Perfect. Thank you so much. Cassandra, I saw you're unmuted as well. Is there, what are your thoughts with one piece of advice or many pieces of advice you'd give a newly diagnosed patient?
Well, I concur with everything Jason and Robin said. I just want to add that um, I think it's important too when you have myeloma or CLL or whatever, and you may have other coexisting conditions, to get your team on board, because it plays a part in the way that you're treated, the medications that you take, and so forth, because one could contradict the other. And two, when you get into these support groups, we see a lot of people with different stages of where they are with their particular condition. So it's important to not let your mind like kind of go there with what you see happening with someone else versus you, because every patient is unique and different. So just kind of gauge the information that you're taking from other patients in your situation, because every situation is not the same.
Absolutely. Thank you so much. All right. We've come mostly to the end of today's webinar. We've got just a little bit of time for Q&A. I want to thank, of course, our panel for all of the wonderful answers. Who better to tell other people how to advocate for themselves, how to, go through this journey than patients or people who have been in those shoes. So I want to thank you guys, number one. But we do have a couple of minutes for some questions. And I'm going to just start here. So I've got one comment. It says, I was diagnosed with CLL in January this year and currently on watch and wait protocol. My oncologist likes to refer to it as active surveillance. That wording sounds much more encouraging. Would you guys agree? Those that went through watch and wait?
I like it. Yeah, active surveillance. Yeah.
I like it
I
too.
take an active approach, even though my CLL is really in the back seat, and I hope it will. It could be 5 years, it could be 20 years before I get to the point where I start having symptoms and I start to need to look at treatment. But that doesn't mean I just, stick my head in the sand. I'm an active participant, not only in my own care, but I love being a part of this and other things that I do in the community and specifically for HealthTree, because there are those that they've gone before me and they're in treatment, and they need to hear encouraging words, and they need to hear, there's hope. And so, yeah, I like that.
I do too. You also mentioned earlier, and I want to come back to it as well, Jason, the coach program. It's been mentioned throughout the webinar. So, as Jason mentioned, it is something that we do have for our AML and multiple myeloma communities currently, and it is something that we are working on as we grow our communities to have it available for all communities. So, the coach program, just as way of introduction, is again that opportunity to connect one-on-one with somebody who has gone through a similar experience. And I know both Robin and Cassandra are part of our coach program, and maybe you could just take a second, Cassandra, and talk about your experience within the coach program. What do you love most? What is, what's been your experience?
So since this is 2025 and I've been since 2018, I must love it. And I actually do. It is a very welcoming organization. You learn so much, not just from what they have online, but the experiences they have one-on-one with another coach or another patient that going through blood cancer. I really enjoy their retreats that they have. We'll go to like the myeloma conferences, and we're in Utah, and there's this doctors and physicians and oncologists from all over the world come to educate us, which is extremely helpful. And it's just, I can honestly say from my experience, it's definitely like family. I feel that the HealthTree Foundation is exactly, they're my family. And I know the founder, she is absolutely amazing. I've had some very trying times, and you will stop and email me or call me and just say, hey, what's going on? Do you need referrals to anywhere? So they are, this is a great organization. Absolutely.
Thank you so much. Thank you. Robin, how about you with your experience so far? Have you been,
It's been wonderful. So I did not seek out a coach when I was going through my induction therapy. It was difficult for me to really talk about it. I didn't really talk to even very many people within my own circle. But once I started maintenance therapy, once I met some coaches when I was at the HealthTree Summit in March and got very excited about it. And so I went through the coach training and became a coach. And I think I have 8 coachees now. In fact, in about an hour and a half, I have a Zoom call with one of my coachees. We meet monthly. So I found it, I hope that it's helpful for them, having the opportunity to ask me questions about my experience, but it's been very helpful for me in my, I'm not going to call it recovery, but in terms of, during this period of my maintenance phase, it's just helped me, I think, learn more about myself, but also the opportunity to just provide support and help to other people who are, going through a similar experience. So yeah, I think it's a wonderful experience.
perfect. Thank you so much. I've got just a comment here. It says, just a comment about having someone with you at an appointment. At my first appointment after bone marrow biopsy, my son could not be there in person. I asked my hematologist if I could dial my son in on my phone so that he could be my second set of ears. That helped. As a healthcare professional myself, when you become the patient, you may not think clearly enough to ask questions for clarification. And I echo that. I think that's so important and so good that we've got these different ways to make those connections and get that second set of ears. So thank you for that comment. Got another comment that says, my oncologist said, the myeloma diagnosis is bad luck, and I didn't like that. I think that the way your healthcare providers communicate with you is so important. And if you're in that situation, you're not liking the way those interactions are going, it's okay to look elsewhere. So thank you for that comment. Let's see. I've got another comment here. It says, I just love Cassandra's statement. You have to understand it in order to beat it. And I could not agree more. I think that's so important. Thank you. Just scanning through just a moment more just to see if there's any more that we will be able to answer quickly. We've got a question just about being able to watch this again later. Yes, this is being recorded. We will email it out and it will also be available on the website. Anything with specific diagnosis or treatment, I am going to hold on to those so that we can get some answers to you through email. Let's see. I'm going to just read this one too. It says, I found that sometimes when I share my CLL diagnosis and that I currently am not in treatment, I've had the awkward response, I guess you are fortunate not to have a bad type of cancer. How do you all respond to such an insensitive remark? I think that's incredible. And I know this came up when we were talking as well, just, if you don't look sick, if you haven't lost your hair, that's kind of a tricky thing to navigate. So I saw Jason came off mute. Can you talk through what that's like for you?
Yeah, it's a little awkward. I haven't had that experience. The experience that I have, I think, now that my larger friend circle, my faith community know that I have leukemia is there's this kind of this big bucket, and it's called cancer, and it's bad, and people expect what I talked about earlier. It's like when you hear you have cancer, you immediately go into treatment. And CLL in particular is being chronic is just different. And so I still, almost a year later now after my diagnosis, people will, approach me and ask me, how am I doing? And first of all, I think just don't be so easily offended. That's an important thing. People, they just don't know, and I can't expect them to know or understand because in my process of learning, realized there's like 4 or 5 different variations of just my cancer, and some are more aggressive and some are less aggressive. And I happen to have the kind that has the best prognosis. I have, I guess, the best kind that you could have. I think the doctor, even in my initial appointment said, if you have to have cancer, this is the one you want. I thought, not really looking for cancer, but okay, if I have to have it, I'll take that. And so anyway, I just can't you can't expect people to understand that. So I just use a lot of grace with folks, and I'm really thankful that they care enough that they are asking, how I'm doing. So that's it's kind of, my unique understanding and take on that, my unique experience. So.
I like that. Cassandra, have you had experiences with people who say insensitive things or even just look at you and say, well, you look healthy? How do you deal with that?
Well, that was on my initial, prior to my diagnosis with a physician. He looked at me and said, "You look fine to me. You'll probably never be back here." And like, what am I supposed to look like? It's one of those invisible disabilities. And I think that subconsciously people don't think about that. And also, like Jason said too, you can be in different stages. There's remission, there's other things like that. It doesn't necessarily mean it's gone. And I personally, and again, it's about education because people don't know. It's not that it's a good cancer, but it's highly treatable. That doesn't mean it's a good cancer because cancer is a malignancy and malignancies are not good. It's the way that we're framing things. And those are just like average thinking distortions that we all have with certain things. So this is your opportunity to make it a teaching moment. And another thing that I get, I don't know about you guys, but I get a lot of people throwing herbs at me. Don't take chemo, don't do this, do the herbs and things, So I get that. But also what people don't understand, I have other conditions that if I take those herbs, it's going to flare, so I can't. So people are trying to be helpful and things like that. But sometimes as a human being, I do get tired. I get frustrated because it's such an internal battle. We have our good days, we have our bad days. Sometimes it's for me. I just don't want to hear that. Some days let me be the woe is me. Woe is me today. And it's okay with that. And then other days I feel absolutely great. I'm strong, but let me go through these seasons and let them be validated. So that's kind of where I am.
Thank you so much. There was something you said in there that I wanted to come back to as well. Um, just the point, I lost it. I'm going to ask Robin to answer that question as well, and then it will come back to me, I'm sure.
That's an interesting question. I haven't, other than close family, and close family, not real extended family, but close family and close friends, I really haven't talked to anybody about it. I'm retired now, so I have a much smaller circle of friends, because I'm not going to work every day. But I haven't really said too much to very many people. Um, and I think partly because I'm somewhat private. I mean, my HealthTree community is probably the largest group of, friends that I have that I've developed that know about it. And that's one of the things that I really like about it is being able to talk to people who are experiencing, while not the same thing, something similar, and understand what I'm talking about. If I have my woe is me days, they understand that. Um, I would say, so, I'm a former, I don't really like to use the word survivor really, but I had breast cancer previously. And, breast cancer gets all the press and everybody rallies around breast cancer patients. Even when I had breast cancer, I told very few people. I was talking to a very close former work colleague of mine just the other day, and who recently went through radiation for another condition, another cancer. And she said, I didn't realize that you went through radiation. And I said, well, I just didn't really talk to anybody about it. I left work. I was able to schedule This is when I had breast cancer. I was able to schedule my radiation treatments at the end of the day. I just left work a little bit early. I didn't say anything. So I don't think, except my boss, maybe was the only person that knew about it. So that's part of it. So I just don't really say that much to people because I don't want to have to explain it. It just becomes very exhausting to me to have to try to explain it and answer questions. So maybe that's the way I've dealt with it. And the people who are close to me that know about it will ask me, and and I'm always honest with them about it, but I just kind of feel like it's really nobody's business. And if they need to know, I'll let them know, and if they don't, I don't.
Absolutely. Thank you. I did like that both of you, Robin and Cassandra, brought up the woe is me moments. Like, it is important to be able to commiserate with other people that are going through a similar situation. So, as Jason mentioned, find those communities, and we're going to continue building these communities for as long as we possibly can and making sure everybody has somewhere and someone to turn to. So, thank you so much. It did come back to me. I just wanted to mention, Cassandra said thought distortions, and it brought up something that I wanted to mention is coming in November. We've got a wonderful opportunity to do a journaling webinar, and we are going to talk about thought distortions. So it's a little bit of a stretch there, but I did want to plug that. So be on the lookout. It should be on the registration page in the coming month or so. So be on the lookout for that. So again, we've got a couple of questions that ended up being a little bit more either personal or diagnostic. So I will get to those in follow-up emails. I will make sure I touch bases with all of you. But want to thank our panel again. Thank you so much for sharing your time with us today. And of course, thank you for sharing your experience as well. Perfect.
You're very welcome.
Thanks, Cindy, for putting it together. Appreciate it.
Yeah, happy to be involved.
Thank you.
Thank you.
All right, we'll go ahead and close out the session today. So as you leave today, again, we'd appreciate you taking the 2 to 3 minutes to fill out our brief survey about your experience. This just helps us get a better idea of what you need and how we can fill those gaps. So I've got a few of our upcoming events on the screen right now. So our next Blood Cancer Awareness Month webinar is Finding Strength After Setbacks. So real stories from relapsed and refractory blood cancer patients. That will be happening on September 16th. And then also the next event here is some of our in-person events. Our team is going to be all over the country in the months of September and October. And these are live in-person events for all blood cancer patients. It will help highlight patient experiences through patient panels, local community providers, and specialists talking about collaborative care. And we just want to get out and meet as many people as we can. So if you're in those cities, think about joining us. And then the next thing I wanted to mention here is for our AML community. We've got some special regional series that are coming up for our AML community. So if you're in the Northeast, that's a session that you may want to join. It is a virtual webinar, and there will be additional webinars for different regions in the coming weeks. And just one final reminder to check our Blood Cancer Awareness Month website, our social media accounts, to see the patient and caregiver stories we'll be publishing throughout the rest of the month. I'd like to again thank our sponsors, Pfizer, Adaptive, Cura Oncology, GSK, AbbVie, Amgen, J&J, and Bristol Myers Squibb. Before we finish, I just want to say thank you again for being a part of our community. I've included my email address on the screen. We love connecting with all of you. So if you are not a myeloma patient and you want to get connected to your patient engagement manager, feel free to email me. I'm happy to get you connected. We truly do love hearing from you and want to help in any way we can. With that, again, thank you to our panelists, and I hope you have a wonderful rest of your day.